My biggest passion in life is soccer. One day my friends came over to my house and we were playing soccer in my basement, and I kicked my toe against the couch and I broke it. So I went to the hospital, and I've been losing a lot of weight, so my mom said to get a blood work. And when I got the blood work, it came out that I had diabetes.
So type 1 diabetes typically affects children. It is possible to develop type 1 diabetes up until age 30. Typical presentation is one of a child that's drinking a lot, peeing a lot, possibly losing weight.
I'm 13 and I was diagnosed with diabetes when I was 7. We didn't really know what to expect. I didn't know anything at all what diabetes was, neither did my parents. We had no clue what we were doing, so we always had to contact the doctor, and my parents always checked on me. They were scared.
So type 1 diabetes requires insulin therapy on a daily basis. It must be given several times a day or continuously via a pump.
When I first got diabetes, I was using the insulin pens, and then I switched to a insulin pump. Having a pump with tubing wasn't good for me because how active I was, it always got in my way. Coaches and friends were scared that maybe if they were running, they would have got caught on them and it could have hurt me.
So insulin pumps are available in two types. One is tubeless, where there is no tube between the insulin reservoir and the skin, and the other is tubed, where there's a cannula or a small tube that connects the pump, which is worn similar to a pager, to the insertion site.
On my parents' research, they wanted to find something that fit my lifestyle. And now that I switched to the OmniPod, it really helps me fit my lifestyle.
It has to be a family decision. The family has to be supportive and has to be knowledgeable of how the pump works. Most children, even into adolescence, may require assistance. And so a family really has to be involved and knowledgeable from the get-go.
But now, since I changed to the OmniPod, it's really gotten better. Since I'm older and I have more knowledge on it, I could change it myself. The pod I have to change every 3 days, and it connects to my glucose meter, which is really simple. Now I can be like a normal kid.
The tubed or tubeless pumps are really a personal decision. Some children who are avid swimmers and in the water a lot may choose a tubeless pump. So the decision is really a personal one.
The hardest thing about having diabetes while playing soccer is probably just getting the exact right amount of blood sugar and trying to control it for a game so you can have a good performance.
So I think it's important for communities to understand that children with type 1 diabetes have specific needs. Schools need to be on board and provide support, and families need to be supported by their primary care practitioners and by clinics as a whole.
Living diabetes as a kid, to be honest, I was really scared. I didn't know what to really expect. I didn't know how to manage it. But after a while, it got easier and easier, and now it's just natural.
Our goal in type 1 diabetes is to have children return to their normal lifestyle, to continue to enjoy everything that they were doing prior to diagnosis, to provide all the supports necessary to the families, to allow them to really learn how to deal with diabetes and to make it as part of their lives so that it does not take over their lives, and for them to be able to manage day-to-day a chronic illness that is very, very treatable.
I play competitive soccer, I play striker, and I've been to Portugal, Brazil, Switzerland, France, I've been to Italy. The diabetes doesn't stop you from achieving your dreams, and you could really do anything. But when I grow up, I want to be a professional soccer player, and I think the first soccer player that has diabetes.
To see if a tubeless pump might be right for the management of your or a loved one's type 1 diabetes, visit these websites.